From those of you that have seen the interview with Jill, you would not notice that she has, by looking at that person on the street, you wouldn't think that that person would be having a diagnosis of cancer the way she looks. And that is the result of doing detoxification, of doing all the treatments or the complementary treatments which we do at Sanoviv. Jill mentioned about many of the treatments that she received, and how some of the treatments, even by some doctors, they were adamant or skeptical about them. And mainly the reason she said it is because most Western trained physicians, and I say this as a Western trained physician, do not know, or many of the times ignore the power of nutrition detoxification because they're not taught in school. And curiously, when you look at research from Harvard, from different universities, you see that they talk about vitamin E, they talk about vitamin K, about fish oils, about DHA, EPA, how they have an effect on cancer cells. But nobody's reading the research, and it's all out there. So when she mentions alternative or conventional, it's really sad that a lot of these treatments that are very scientifically studied and validated are labeled as alternative or as something that should be a conventional treatment. We know that if we give the cell what it needs, based on Dr. Wentz's knowledge, the cells will repair and the cells will increase and do their function. What cells am I referring to? We know that our immune system is a cellular immune system, and if these cells are boosted, if their function is improved, then the immune system is increased. So these are white blood cells that make chemicals, make cytokines, make different antibodies that for them to make them, they will have to be nourished. So that's basically the principle of treatment. Jill mentioned something about transfer factor, specific transfer factor. What we're doing there is we are grabbing a sample of the tumor. That tumor has surface proteins, which are called antigens. And we send that to a specialized immunology laboratory at a university, and they prepare antibodies. They isolate dialysates of white blood cells, and they isolate and concentrate antibody cytokines that are specific against that cancer. It's a toxic-free treatment. It boosts the immune system, and it helps their own immune system recognize the abnormal cells so they can attack them and inhibit their growth. So she mentioned that she was surprised by the results, and we see these results all the time. She takes the treatment, the size of the tumor goes down, and you didn't do chemotherapy, you didn't do radiotherapy, so it makes one think, can the body really clear out cancer by itself? If we give it what it needs, it can certainly do it. And you see the results with Jill. It's been 3 years since her diagnosis, and she looks great. And of course, we've combined all the conventional treatment, which we know that is necessary to buy us time, and we've done our conventional treatment, which is a scientifically valid treatment, and we get the best result. She talked about hope. How important is hope? Hope is very important. We're not selling false hope, but we're giving them realistic hope, because we've seen results in other people that are away from the statistic. That's what we're all about. We want to change the statistics. We don't want to practice medicine based on a statistic. Statistically, this is how you're going to do. No. We're going to treat you. We're going to find the cause. We're going to find what is troubling your system and making it dysfunctional, and we're going to make you a success case. And that's basically the Sanoviv approach. We know that the ovaries are a hormone-sensitive organ. They produce hormones themselves. There are many different things that in our environment nowadays are creating these disruptances. What we find on one person is totally different than what we can find on another patient with the same type of cancer. So the key to it is individualized treatment. And another one of the important aspects, she mentioned that hyperthermia. That's a very specialized type of treatment where we're heating up the body and creating a fever, an artificial fever, knowing that cancer cells cannot thrive on a higher temperature, and also knowing that the immune system goes into an alarm phase when there is a fever. It triggers the release of different types of antibodies. So we are focusing on the function, we're focusing on getting the body itself to fight the disease. You know, it's curious that we see sometimes people with a very large tumor and their body's not reacting because the body is blocked. The body is not recognizing a problem there. So what we want to do from the functional medicine aspect of ovarian cancer is wake up the body, make it react, make that immune system recognize that there is a problem and fight it. Otherwise, you just leave an empty or a free opportunity for the cancer to just reproduce. So that's basically our approach in waking up the body's response.